So the diagnostic sacroiliac joint injection based on the recommendation of AANS and NAS is a low volume articular injection to the sacroiliac joint. Practically, this is the ligamental part of the joint. This is the articular part of the joint. So under fluoroscopic imaging or CT guidance, we enter the sacroiliac joint in the articular region, and generally we put a low volume, which is about 2 cc of marcaine or lidocaine. Obviously, depending on what we use, the effect is expected to be longer or shorter. According to the protocol, it has to be confirmed with the injection of 1 cc or low volume of contrast and fluoroscopic or CT guided imaging to be sure we are in that region, in the articular region, and then practically putting 2 cc of, I put 2 cc of marcaine, and then confirm it with the fluoroscopic imaging. It can be done for both sides or one side, but the documentation is the most important part. We document with the form the pain before, as well as activities that are possible before the injection, and at least for the 3 to 5 days period, we should as well track the pain level as well as the activity level. If 75% improvement is achieved in 3 consequent injections, constantly after every time we inject, 75% of the pain goes away, the diagnosis is confirmed. The first injection is diagnostic, the second and the third are confirmatory. And as well, it's important to know that the effect does not last. It's the education of the patient is the most important part. Some patients are looking for the problem to go away. This is not how it works. The way I tell my patient is that it's the same thing that the dentist put in your gum. In the gum, because of it's well perfused, the effect lasts about 4 to 8 hours. But here, because the perfusion is not as good as the mouth area, it can last up to 2 or 3 days, but that is the maximum. I get some patients that come back and tell me that after 3 days, pain came back with a vengeance. So part of the protocol is pain to come back is expected, as well as obviously we sometimes tell the patient to go and do things that are painful. Sometimes they come and literally tell me that the pain is coming back with a vengeance. That means that after the initial improvement, when they used it during the numbness of the joint, they overused the joint, then 3 days later, pain comes back actually even worse. Another thing that is important is that the pain can go side to side. These are as well expected because one side we use it and they become painful, then we shift away to the other side, and then the other side gets worse, and it can go back and forth. So change of side as well need to be documented is a good diagnostic sign. Pain coming back worse after 3 days is a diagnostic sign. Pain going from side to side is important, but as well more important is 75% improvement of the symptoms after each injection, even for hours, but sometimes it can last for a few days. So the filling that form is important. Now, it is important that lots of patients, they have L5, S1, or sometimes even L4 nerve root irritation because of the joint inflammation. The inflammation can go to these nerve roots. If the problem is the pain of those nerve roots, certainly injection can take the pain away, but numbness will not go away. Numbness going away is not part of the diagnostic. As a matter of fact, we put a numbing medication, the numbness can get even worse. And as well, there are some odd complication or side effect that can happen from the anterior part of the nerve root, like pudendal nerve, that people can have some sensation, funny or unusual sensation in the groin or genital region, or numbness in that area. But that is not really diagnosed. These are all more odd kind of side effect of the injection. Okay, thank you.